teach now, we're going to talk about what directions we have to go once we are talking and palpating on the scalp. In other part of the body, it's a little bit easier because you know where you are going to, right? You are going down, you are going up, you are going, it's pretty clear. On the head is a little bit like tricky, and it's just because we have a kind of like a round shape up there. That's why you don't know when to use anterior, posterior, or lateral, or whatever, right? So I made this to clarify this a little bit. So this is like a cube, right? And here you see the anterior surface of the face, top part of the head, back of the head, and the side of the head, okay? So what you need to imagine while you are palpating, you need to have a box on the head. Okay, something like this. Okay, now just imagine I'm going to palpate something over here on this side. Okay, so if I'm moving on this plane, which we call it what plane? Sagittal plane. Thank you. So I move what direction? If I go back, posterior. Perfect. So if you just look at the skeleton, do you see these little edge here? Like we just mark it as a zygomatic or your cheekbone. So once you are hitting this part, there is no more anterior. So you just stop all the way till you reach the zygomatic bone. Okay? And from the back, do you see this edge here? Okay, there is no actual name for it, but whenever you feel your scalp going like in like this, so you gotta stop here. Okay, so all the way back, posterior, 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 up, I hit it, so no more posterior. So it's gonna be something else. Okay, so let's see what it's gonna be. So from the back, because we just talked about, from the back, okay, so imagine this is the edge here. Okay, if I want to go more, what direction am I going? So if I want to go back till reach the edge, there you go. If I want to go up until again I reach the edge, okay, and if I want to go down, inferior. Does that make sense?
Yeah.
Great. So let's just talk about the front face as well. Okay. So again, these two little marks that we need to remember is the zygomatic bone, right? So have it as a reference, and from the top, from the up, we have our forehead, the part that it actually goes whoop, like this. So you stop here. And from down, so we have our jawline, right? Okay, so you tell me, if I want to start here and then just go all the way till reach the zygomatic bone. If I want to go back, medial. If I want to go up, go down, inferior. So what happens over here? So we have the circle around on the scalp, right? So again, we have edge here, 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 and here. So you go all the way till you reach the edge. For example, I start here. If I go here, what am I gonna go? Lateral. How about if I just keep going? What's gonna be? Fatty. I said it in Persian. Good job. So let's say for the anterior and posterior now. So I go in the center. Now I'm just gonna go all the way till I reach the edge. So what is it? Interior. So what if I just keep moving? Interior. There you go. You got it? Perfect. So you can take a picture of this one if you want for your reference.